Unit 3 Health, Safety and Welfare in a Fitness Environment. Controlling Risks in a Fitness Environment. Aim of the session: to gain an understanding of how to control risks in a fitness environment. Learning outcomes. By the end of this session, you will be able to identify possible hazards in a fitness environment. Describe how to risk assess the types of possible hazards in a fitness environment. Describe how to control risks associated with hazards in a fitness environment. Identify the appropriate person or position to contact within a fitness organization when hazards and risks cannot be controlled personally. Risk assessment. A risk assessment is a careful examination of what, in the workplace, could potentially cause harm to people. It enables the individual to grade any potential risks and evaluate if sufficient precautions have been taken to minimize the likelihood of their occurrence. How to assess risks in the workplace. When assessing any risks, there are two major considerations. Number 1, likelihood. How likely is it to happen? Number 2, severity. How severe could the consequences be? 5 steps of a risk assessment. Number 1, look for the hazards. Slips, trips, falls, chemicals, machinery, electricity, manual handling, noise, poor lighting and temperature. Number 2, decide who may be harmed and how. Office staff, cleaners, visitors, contractors. Pay particular attention to people with disabilities. Number 3, evaluate the risks and decide whether existing precautions are sufficient. So provide instruction or training where necessary. Reduce risk as far as reasonably practical. Number 4, record findings. And number 5, review assessment and revise it as necessary. Risk ratings. Risks are rated using a numbered system from 1 to 5, with 5 being the most severe and likely and 1 being the least severe and likely. The two numbers are then multiplied together to give a risk rating. Depending on the result, action may need to be taken. If a score of greater than 11 is recorded, the associated risk is considered to be high. High-risk situations need immediate action. If, on the other hand, the score falls between 3 and 10, the risk is said to be moderate and risk controls must be maintained. When hazards or risks cannot be controlled personally, it would be prudent for the instructor to contact the person in charge of health and safety within their department. Please have a look at the table below. Task. In pairs, carry out a risk assessment for your local gym which you attend. Note, this can be done either by actually going into the appropriate area or by considering the sorts of hazards you could expect to find and evaluating them accordingly. Manual handling. In order to minimize any risks involved when lifting and carrying objects, consider the following: lifting technique, climbing, pushing and pulling, and pivoting. Any job that involves heavy labor or manual material handling may include a high risk for injury on the job. Manual material handling entails lifting, but also usually includes climbing, pushing, pulling, and pivoting, all of which pose the risk of injury. Musculoskeletal disorders often involve strains and sprains to the lower back, shoulders, and upper limbs. Potentially injurious tasks may involve bending and twisting, repetitive motions, carrying or lifting heavy loads, and maintaining fixed positions for a long time. These circumstances can lead to damaged muscles, tendons, ligaments, nerves, and blood vessels. Ergonomic intervention in manual handling can decrease injuries and increase worker productivity. Exercise risk assessment. Previous risk assessments have concentrated upon the environment. However, there is an inherent risk associated with any fitness activity, so it is incumbent upon the fitness professional that safe choices are made. Task. In pairs, consider what other factors could influence the safety of any exercise program. Did you have medical status, dysfunction or restricted range of motion, fixed resistance machines, proprioception, occupation, risk category, injuries, weight or resistance, nutrition, recreational activities, past surgery, body type, speed of movement, and stress. Summary. It is the duty of the fitness professional to ensure all aspects of the working environment are safe and that hazards have been minimized. Be aware of their roles and responsibilities in the event of an incident. Demonstrate a duty of care to any client in their charge, taking all reasonable steps to assess and reduce the risks whilst the client is exercising. Learning outcomes. Can you now identify possible hazards in a fitness environment? Describe how to risk assess the types of possible hazards in a fitness environment. Describe how to control risks associated with hazards in a fitness environment. Identify the appropriate person or position to contact within a fitness organization when hazards and risks cannot be controlled personally.